Dr. Brownstein, thank you so much for joining me. Really appreciate your time.
Thank you for having me.
So I'd love to just start with how does a medically trained doc get involved in the natural world of things? What's your
Yes.
story?
Yeah, I certainly didn't start out that way. Um, I grew up in a conventional household. We didn't take any vitamins or minerals or pay attention to what we ate. And just went to the doctor when we were sick. We took whatever the doctor told us to take, and we didn't question anything. And I grew up with a bad case of asthma, severe case of asthma, multiple trips to an emergency room. And um, when I was a kid, I was sure I knew how I was going to die. I was going to figure I was going to die in a asthma attack. And so I had a lot of exposure to medical doctors just because I was sick. And I always found science fascinating and medicine fascinating. And since I was little, I always wanted to be a doctor. And so I geared my training at the undergraduate, you know, reigning undefeated national champion Michigan Wolverines. If you can't see this, I'll just make sure it's um, and to go to med school. And I went to med school at Wayne State in Detroit, and I bought into everything I was taught. I thought drugs were the answer to everything. I thought I was taught to diagnose pathology and then prescribe the one drug to treat that pathology. And I bought into it. I thought that's had the answer for everything. So I used to tell people back then, don't take supplements. It's a waste of money. I made fun of my mother-in-law for taking supplements. She was way ahead of me back in the day. She was a big fan of Adele Davis, and she used to get a couple newsletters and show me the newsletters. And I thought, oh, I just tell her you're just making, expensive urine. Um, and so I went to because I saw my family doctor a lot for my asthma. I just decided I wanted to be a family doctor, and it's what I went to med school for. And so I finished a residency in family practice, and the that's where I am. So I started practicing conventional medicine as I was taught, and I was diagnosing pathology and prescribing the drug to treat that pathology. And I was like, this was my only. This was plan A. There wasn't a plan B. This was it. This is what I thought I wanted to do my whole life. And around 6 months into that practice, I started to have some anxiety out of nowhere. It popped up. And I lost sleep for a couple of days. And I was getting up and getting ready to go to work. And it was about 3 nights a row of not sleeping great. I blurted out to my wife, I don't want to be a doctor anymore. I had never said a word to her before this. I met her when I was 18 at orientation at University of Michigan, the reigning undefeated national champions in football. And um, since she met me, that's all I talked about was being a doctor. I didn't. There was no plan B for that. So she said, "What's wrong?" And I said, "I'm not helping people. I'm just prescribing drugs that most of the time aren't treating the underlying cause of the problem, and they're just treating symptoms. And I'm having to prescribe other drugs to treat the problems from the first drugs. And the people aren't getting better." And I said, "I can't do this for the next 30 years." She said, "What are you going to do about it?" And I said, "I don't know." Now, at that point in our lives, she was pregnant with our first child. We had $100,000 in student loans. I didn't have any backup plan. And, this anxiety started to overflow in me. I've never had that before. And that same day I said that to her in the morning, getting ready to go to work, saw a patient in the office, and the patient had been bothering me to meet his chiropractor for a long time. His wife and my wife were friends, and they worked together. So we've done something socially, and he talked to me about how his chiropractor really helped him, not so much with adjusting, with I don't know, giving him things. Later there's supplements. I didn't really know what he was doing, but a chiropractor helped him much more than adjusting him. Now, before that, I never referred to a chiropractor. I used to tell people they were dangerous. I never knew what a chiropractor was. Never went to a chiropractor. Never met a chiropractor. But we were taught in med school they're dangerous. People shouldn't see them. And so I used to parrot that as well. Well, in that period of anxiety and lack of sleep, I saw that patient that morning. He gave me that chiropractor's name and number. At lunchtime that day, I called him and set up a dinner meeting for a following Tuesday. And Tuesday rolls around. I come home from work. I tell my wife I'm going to cancel that dinner meeting. I don't feel like going, and it's a waste of my time. And she said, it's too late. That would be rude. You need to go. And as I was walking out the door, she told me to be nice. And I went. And the chiropractor's name was Dr. Robert Radke. He had been practicing applied kinesiology and nutritional chiropractic medicine for, he was older than me, probably 20 years at that time. And we hit it off right away. We hit off a friendship right away. And he started talking to me about functional biochemistry, like actually looking at biochemistry, thinking about biochemistry, and figuring out why the biochemistry is disordered in people who aren't feeling well or have chronic disease, and how to optimize biochemistry or normalize biochemistry. Now, that was a unique concept to me at dinner that night. To go to med school, you have to take biochemistry, which I took, and I got an A. To be in med school, you have to take biochemistry again, pretty much the same course. I got another A. I thought I knew biochemistry, but what I knew how to do was to memorize these pathways and spit it out in an exam and then delete the files after they were out, because you didn't use them. You weren't taught how to use that stuff. So it was really just another science course that was kind of useless for medicine the way it's taught. And then at that dinner, Dr. Radke's talking about functional biochemistry and what he's doing with his patients. And either he was lying to me, or there were other ways to treat people that I wasn't taught in medical school. He brought me a book at that meeting, Healing with Nutrition by Dr. Jonathan Wright, who's an allopathic physician. And I went home with that book, and I went home charged up that, this was exciting to me. So I opened that book and I read that book till 2 a.m, and I had to work the next day. And I woke up all excited, and I called my dad in the morning before I left for work, and I said, hey, can you stop in the office? I want to draw a couple of blood tests on you. Now, my dad had his first heart attack at 42, his first heart attack at 40, his second heart attack at 42. Over the next 20 years, he had multiple angioplasties. He had 2 bypass surgeries. And at that point in my life, he was on 12 medications for heart disease, diabetes, and hypertension. And my dad looked terrible. He looked like he was going to die at any moment. He was blue and pasty. He was popping nitroglycerin pills for angina like they were candies every day for 20 plus years. And he couldn't do anything. Anything he would do would cause chest pain. So we were all waiting for the phone call that he had died. And because of what I talked about with Dr. Radke, because of what I read in that book that night till 2 a.m., I drew 2 blood tests on him. I drew his thyroid levels, much more in-depth thyroid levels than what I taught in medical school, full thyroid panel instead of just a TSH level. And we can get into that in our talk. And I drew his testosterone levels. And his levels come back 7 days later. His testosterone levels were below detectable limits from the lab, and his thyroid levels were in the reference range, but in the lower part of the reference range. So I put my dad on 2 things, natural thyroid hormone and natural testosterone. Within 7 days, his 20-plus-year history of angina melted away. He never used another nitroglycerin pill. Within 30 days, his face pinked up. He felt better. He was doing things without chest pain. I get his blood work again, and his cholesterol, which has been perpetually stuck in the 300s, on medication and on a terrible diet. I mean, my dad ate horribly, smoked, he was overweight, he never exercised a day in his life. I mean, my dad could eat like the best of them out there, but he looked better and he acted better. And his cholesterol now, instead of the 300s, was below 200 without changing any of his bad habits. And I saw the changes in my dad, talked about it with Allison that night, and I knew I made a change. So I went to the practice I was in, which I was going to be a partner. And I said to the partners, no, my wife's ready to have that baby any day. First baby's coming. We're just waiting for it. I went to them and said, I'm not going to be a partner anymore. And they said, what's wrong? And I said, nothing's wrong, but I want to go practice a different type of medicine. And they said, what's that? And I said, I'm going to do holistic medicine. Told them about my dad, his story. And they said, what's that? And I said, I don't really know, but I'm going to have to figure this out. And they said, why don't you just do it here? And I said, no, I need to be in an office where people answering the phones, the nurses, the file clerks, Everybody in that office is under, working for one thing, for health. Um, and so I left, and here I am 30 plus years later. And, I've written 17 books, write a national newsletter, got a busy practice. I'm practicing with my girls who are both doctors and having the best time of my life. And it was the best thing I did. And I do credit my friend, Dr. Robert Radke, for that. He's the one who allowed myself to sort of make that pivot in, 180-degree pivot and, walk the other direction. And it's been a great walk. And hopefully I can walk a lot longer at it. And I'm still figuring out what holistic medicine is, but I have a much better idea about it now than I did 30 years ago.
That's amazing. I think we're all still figuring out what it is, right? And
Yep.
it's just to me, it's amazing that you were humble enough to learn. Like the story when I talk with a lot of doctors who who aren't natural or who don't go in that direction and just kind of do mainstream care. And it's just hard to get through to a lot of them because they're just not willing to learn. They're just not open-minded to even crack a biochemistry, nutritional text or anything else. And the
You
fact that
know,
you just were able to do that just speaks volumes about your goodwill and what you got into it for the right reason.
so I just saw this patient the other day. She's a high school senior, and her and her mom flew out to see me. And just talking to her, and I said, "Hey, what's the plans for next year?" She's applying to all these schools. She's waiting to hear from Stanford and some other top-notch schools. I said, "What are you going to go into?" And she told me about. I said, "What classes are you taking this year?" And she tells me, and I said, "Well, what's your plan in life, or what? You have any ideas?" And she said, "Marketing or something like that." And I said, "Well, why are you taking physics and calculus?" And she said, "Well, I was kind of thinking of medicine, but all the doctors I talk to hate medicine. And so I don't think I want to do that." I'm like, "Wait a minute. Let's spend a few minutes." So talked to her about it. And I said, "If you go into it for the right reason, medicine is fantastic." And said, "It's been the best career. I couldn't ask for anything better." And the doctors I know that are unhappy in medicine are the ones that didn't go into it for the right reason. And I think and look, conventional medicine has a lot to offer too. It's not just one or the other. I think I combine both of them. I think that there's good to take out of both. Um, but if you go into medicine for the right reason, it's a fabulous way to earn a living and, helping people and doing the right thing. And I think I found one of the better ways to do it. So I tried to talk her into it, and she seemed a little bit more charged up about it when she left the office yesterday. So hopefully it made a dent in her.
Yeah, yeah. That's awesome. I think we need more doctors that think along that way. We need more people that just want to get into it for the right reasons and just be of service. You've written a lot of books. One of the books I read of yours years ago was on the thyroid, on healing the thyroid naturally. That was actually when I was a graduate student, and it stuck with me. I have a copy of it, right here,
Uh,
and
that's an old version.
an old version. Like I said,
That's
I
a,
read it a
I
long
love
time
that.
ago.
I love that cover. Let me find my, I got to find my new cover. Here's my new cover.